disc or spinal stenosis or degenerative disc, it can rebuild those discs. And we have a version of that too that we're offering right now much cheaper than most of the therapies around. So those are ways you can rebuild structure if you've had problems with exercise. Stress. There's all sorts of stress. The worst kind, of course, is catastrophic stress. War, poverty, post-traumatic stress injury, major injuries. I'm sure you've seen on the news the horrible bus accident we had over in Bluffton a couple weeks ago, and some of those kids are going through that. A second aspect of stress, which is also can be substantial, is high degrees of ongoing stress due to the work environment or relationships. That can eat on you day after day after day. And then finally, just the everyday stress that we get from living in a stressful world, a busy world with a lot of pressure in it. And all of these aspects of stress need to be dealt with in one way or another. And it can be done by doing some lifestyle things, some type of relaxation technique, for example, or it can be done by reducing the stress itself. The ARIC study, this is the same study I referred to earlier, but a different aspect of that study looked at people who had pre-hypertension, and they took out the people that had excessive anger in their lives or excessive stress in their lives. And those people had a much higher progression from pre-hypertension to not only high blood pressure, full-blown high blood pressure, but also coronary artery disease, and they had a higher death rate from coronary artery disease. Now there's biofeedback is a conventional way to treat this. It's kind of an alternative way, kind of an integrative way, but it is used by some integrative physicians. And there are some instruments out there. There's one called Respirate, which will help you lower your blood pressure by using a biofeedback device that you learn to control your blood pressure and learn to lower it. Sort of like playing a video game. It's that type of thing. And there's another one called Heart Math that can decrease the effects of stress on your body, particularly if you have coronary artery disease or heart problems. Stress control in integrative medicine includes a wide variety of things, and a lot of them are available in the Lima community. There's mind-body techniques such as yoga, Tai Chi, meditation, guided imagery, hypnosis. There's another one called Psych-K. All these require just training and learning techniques that you can use when you need them. And they can be very helpful in reducing stress. Just slow, deep breathing. Breathing in and filling your lungs and then through your mouth, and then breathing out through your nose and relaxing as you breathe out. That's a very cheap and simple way to relax. It's very important that we get restful sleep. If you don't get adequate sleep, you're going to have a higher incidence in most diseases, particularly cardiovascular diseases. There was one study that came out that showed that people who took, these are people over 50, who took naps 3 times a week at least, had a 37% less incidence of heart attacks. So naps are good for you, as long as you don't overdo it and then throw away your nighttime sleep, or throw that out of kilter, which certainly can happen. Healthy habits, affirmations, having fun, very important, and spirituality. There's another study that showed that people that had a strong religious faith had much less incidence of heart attacks than people who took aspirin, for example, to prevent heart attacks. So that can be a big factor. Another thing we do in integrative medicine, we look at the adrenal function. And we do a simple test called an adrenal stress index. It actually takes your saliva 4 times during the day, and it measures your cortisol in your saliva. And boy, that really shows, you can't lie when you have the adrenal stress index. It shows not only you have excessive stress, but it tells you what time of day you have this excessive stress and how well you're dealing with it. And if you have excess cortisol levels during the day, and the most common time when you have trouble is late in the afternoon. If you have that, you can take supplements that boost up your adrenal function that can help you deal with stress a lot better. And there's other supplements that can be used to help you deal with stress. And the great thing about them is that they're not addicting, and they're cheaper than drugs, and they're safer than drugs. They don't have side effects for the most part. There's herbal preparations. There's amino acids you can take, like 5-hydroxytryptophan and several others. There's homeopathics, which are very, very, very dilute substances that are very safe and can be very useful. And acupuncture can be helpful too. There were 2 studies reported in Science News in 2003 that were really powerful studies. What they did is they showed that our body fluids are just virtually full of chemicals. And they're huge numbers. And there was another study that came out that looked at the cord blood in babies. So this was the blood of babies before they were born. And they tested for toxic chemicals, and they found an average of 270 to 280 toxic chemicals in these babies before they were even born. So we live in a toxic world. 74 million Americans also have sensitivities to chemicals, allergies, low-grade allergies. Now, if you go to an allergist, they're not going to test for chemical sensitivities. But if you're bothered by cigarette smoke, say, or perfumes, or other chemicals or fumes, a large percentage of people in the United States have these problems. And they decrease your immunity if they do. So it's really good to go through and do some measures for detoxification. Exercise is one good one. Sauna is really good. Drinking a lot of water can help. There are certain herbs such as milk thistle can really flush the body from toxins. Colon hydrotherapy, colonics, are available. We do it in our office. And then as far as sensitivity goes, you can do allergic sensitivity desensitization. And there are several different ways to do that. We do it by injection sometimes in our office. Sometimes we do it by tapping on acupressure points that don't involve needles at all. And that can be a very effective way to desensitize against these toxins. But minimizing exposures is helpful. Organic foods, this one study showed that kids who ate primarily organic foods had only 1/6 the number of toxins of kids who did not. So that's a huge increase. A large source of the toxins in our environment is from our foods. Others are airborne. BP, good example. There was a study that came out in Circulation. This is the American Heart Association journal last summer. And it showed that people who had low levels of lead, they were detectable but low, but previously they thought this was perfectly safe. But they found out people that had these low levels of lead had an increased risk of cardiovascular disease, heart attacks, strokes, cancer, and arthritis. So, very important study. Now the problem is, you probably don't know if you have increased levels of lead because nobody tests you for it. Most doctors don't test. And if they do, they test for this, the blood test, which is what they were talking about in this study. Well, the blood test is only positive for a few days. And then the lead and these other toxic metals migrate and go into the bone, or they're stored in the brain or in the fat cells. So if you do a blood test, it doesn't show up. So we do a challenge test, which means that if you take an IV that contains EDTA in it, that pulls toxic metals out of these storage places into the urine, and you collect your urine for 6 hours, and then you find out how many of these toxic metals you have in your system. And most people have some. A lot of people have a lot of them. And it doesn't mean you've had a high exposure to a specific plant, or a specific source. You could